The man who is on House Minority Leader Boehner's so-called Truth Squad, Representative Bill Cassidy. Congressman, welcome. We're glad to have you this morning. Well, it's been a very interesting morning, and folks out there on Twitter and Facebook, there's no question they're following it. Kaylee Hartung, who's here with me. And Kaylee, the thing that everybody seems to be taking most note of is the little exchange between the president and John McCain.
That's absolutely right. About 30 minutes ago, Twitter blew up. McCain was needling Obama for waiting a year to make good on his campaign promise to have these debates televised on C-SPAN. Let's take a look at what they said.
Let me just make this point, John, because we're not campaigning anymore. The election's over.
I'm reminded of that every day.
Well,
So there you have a little needle back and forth, because John McCain was kind of needling the president for waiting this long to have this televised back and forth between the two of them. Any other comments that are getting a lot of attention on Twitter, Katie?
You know, it's interesting now that Press Secretary Robert Gibbs has joined Twitter. He's putting in his 2 cents in live tweeting, you know, making sure everyone knows what the CBO estimate is saying, making sure everybody's got the White House's facts out there and out in the open. We had one guy on Twitter say, you know, there hasn't been much progress so far in this morning session. Maybe they can use this afternoon session to secure an agreement on repealing the designated hitter rule. I mean, this is what makes Twitter so much fun. Everybody's having a live conversation as they're watching this all unfold.
Well, Congressman, let me go to you and get your reaction. What about that little exchange between the president and John McCain? Obviously, that's not about the substance of health care, but it does seem to be a fairly civil discussion, although there have been some needles back and forth. What's your reading of it so far?
Well, I think that the American people have wanted to be involved in this process. And so during the campaign, I thought President Obama, then candidate Obama, did a good job of saying he would be inclusive. But this has not been. When I first got elected, I saw a colleague on the other side of the aisle, a physician. I said, physician friend, can we partner? He goes, I'm not invited. This is a small group of people in leadership who are writing this bill with their aides. Now, if a physician who's a Democratic congressman feels left out, imagine what Republicans and the American people feel. Well, I think there's a little truth there.
Well, let's talk about today, though. What do you make of what happened at this? Some people say this is all just a political show. Others say the president really is trying to make an effort here. Do you see anything coming out of this? I mean, what's the most striking thing you've seen so far?
What I think it is actually shedding light. For example, there's been things said which can now be contradicted, and the contradiction has to be acknowledged. So when the president said that his plan would lower insurance premiums, Republicans responded no. I think it was the Centers for Medicaid and Medicare Services says it will raise. He acknowledged that, but attempted to justify, and then there was a reply again to that. Senator Baucus earlier said that HSAs, health savings accounts, were only for the middle or upper income. But it was pointed out later that no, actually 27% of people with HSAs were previously uninsured. That's good for the debate.
Well, Kaylee, what are they saying on Twitter? What are the questions that people have about this plan? I'd like to ask the congressman and get some of his take on this.
Absolutely. You know, politics aside, here is a policy question from Emily in D.C. She says, I don't have access to health care because I'm freelance. How exactly will I get affordable health care without an employer?
Have you heard anything this morning that helps this person answer that question, Congressman?
Well, I think one of the places where Republicans and Democrats break apart is that I think Republicans are more sensitive to the issue of cost. So when the president says, sure, costs are going to go up 10 to 13%, but that's because you have a richer package, Republicans will reply and say, wait a second, the very fact that it goes up 10 to 15% means that people will not be able to afford it. And indeed, some people ask for, say, a catastrophic only policy precisely because that's what works best for their finances and their health. I would like to think that the Republicans are a little bit more sensitive to the issues of cost for a freelancer like that.
Congressman, do you think that any votes are going to be changed? Do you think anything is going to happen as a result of this assembly of people today?
Bob, this process has been inspiring. Beginning in August, the American people have said that they want a different product than what has been produced. And we can see, I'd like to say that the Scott Brown election was an exclamation point on that conversation. I would like to think that when the American people partake of this, they will continue their feedback to their representatives. I would like to think that votes are going to change more to what the American people want, which is more cost containment.
All right. Well, thank you so much, Congressman, for being with us this morning.